Good morning. My name is Dr. Rebecca Bryan, and we are thrilled to have you participate in this webinar with us today. There has never been a better time for organizations to become trauma-informed and healing-centered. And so we really appreciate you taking the time today to spend the next hour with us. We do apologize for the initial delay. There's been some technical difficulties, but we're ready to go now. So I'm going to invite Idamas to share the slides. Okay, so we are here today to talk specifically about the tool that we're releasing that will allow organizations to assess where they are in their level of being trauma-informed. It's called the Trauma Responsive Understanding Stress Assessment Tool 2.0. Idamas, right now, the screen that you're sharing are the slides with the notes. If you could switch.
Okay. 1 second, because my computer is all weird things. So just give me 1 second. Is that better?
No. I think you need to unshare. Stop sharing. There, that's better.
Okay. For the further technical difficulties. Is this better?
Yes.
Okay. Okay.
Okay. Deep breath. I want to introduce our panel as well. Idamas Lamort is the Assistant Director of the Office of Resilience. Tia Sanders is our Project Manager. And Jenna Velez is from CCSI in New York. And that is the source of our receiving our ability to access the trust. We're thrilled to be able to offer this to you because the first step for any organization to become trauma-informed and healing-centered is to be able to assess itself and assess where it is in the different stages. We're also thrilled because traditionally it has been expensive to access knowledge about trauma-informed science. But our Office of Resilience is making sure that this knowledge and that the tools that you need are always available for free. And so this trust is available to any New Jersey organization for free, both to use as an initial assessment and then for ongoing assessment as well. Next slide. These are our goals for our time together this morning. We want you, by the end of this time, to be able to understand the vision and the mission of the New Jersey Office of Resilience. We will be sharing an overview of trauma and trauma-informed approaches. We will be discussing CCSI and OOR's partnership, and we will be giving an overview of the trust tool so that by the end of this time together, you feel comfortable looking into it for yourselves. Next slide. This, as you see, are the vision and the mission of our office. The Office of Resilience helps New Jersey residents, communities, and organizations develop and strengthen the ability to bounce back from adversity by raising awareness about the impact of positive and adverse childhood experiences on well-being across the lifespan, by providing resources to promote trauma-informed and healing-centered care, and facilitating partnerships across the state that enable community-driven solutions to promote resilience. Resilience is not about being unbreakable. It is about being able to put the pieces back together and to continue on with renewed hope and courage. I'm now going to turn over the slides to Tia.
Hello, thank you very much, Rebecca. A healing-centered approach is holistic, involving culture, spirituality, civic engagement, and collective healing. A healing-centered approach views trauma not simply as an individual's isolated experience, but rather highlights the ways in which trauma and healing are experienced collectively. The healing-centered approach expands how we think about responses to trauma and offers a more holistic approach to fostering well-being. With the healing-centered approach, one can say, I am more than what happened to me. I am not just my trauma. It suggests we incorporate trauma-informed approaches and identify strengths inherent in individuals or a community as the foundation for healing. The focus is on the fundamental belief that the person who survived trauma is not broken or needing to be fixed, but is already whole and has the capacity to grow from what happened to them. And we as a community have the ability to be healing-centered for all. Next slide. SAMHSA, the Substance Abuse and Mental Health Services Administration, defines trauma as a result from an event or a series of events or a set of circumstances that are experienced by an individual as physically or emotionally harmful or threatening, and that have lasting adverse effects on the individual's functioning and physical or social and emotional or spiritual well-being. In short, trauma is an event that is experienced as physically or emotionally harmful or life-threatening and has lasting effects on individuals and or communities. Next slide. Trauma-informed is a continuum. Trauma awareness is learning and understanding about trauma, its prevalence, and its effects. Trauma sensitive is transitioning from learning about trauma to thinking about how it relates to everyday practices and interactions in our lives. Trauma responsive looks at shifting a person or organization's response to trauma. And healing centered is about shifting a system or culture collectively towards being more healing centered. In order to be trauma-informed, we must embrace these fundamental principles of the approach as outlined by SAMHSA as a guide for implementation. First, safety. Safety is paramount. Safety in physical settings and in interpersonal interaction is key to all trauma-informed approaches. Second, trustworthiness and transparency. Operations are conducted and decisions are made with transparency, consistency, and respect and fairness to build and maintain trust. Third would be peer support. Support from those with shared experiences or lived experiences of trauma and supporting those. Fourth, collaboration and mutuality. Partnering and leveling of power differences between and among staff and those served. It's about promoting collaboration and partnership as healing must be a collective community responsibility. Fifth is about empowerment of voice and choice. Individual strengths and experiences are recognized and built upon and incorporated into the work that we do. It's not a top-down approach, but shared input by those affected by the decisions being made. And finally, the cultural and historical and gender issues are acknowledged and actively addressed within an organization. An organization moves beyond cultural and gender stereotypes and biases and takes actions to address these. These 6 principles are the foundation for trauma-informed approaches and implementation. Trauma has and affects many areas of our lives like a domino. Some effects of trauma affects us behaviorally and affects our behavior and our interactions and our regulation. It affects us cognitively in terms of our ability to learn, our memories, how we organize our thoughts, how we develop skills, and even the competencies that we develop. It also impacts our mental health and mental health diagnosis and how healthy we are, and then physical health. Trauma can have long-term impacts on those who've had trauma, can have poor health outcomes due to the impact of toxic stress on the body. The prevalence of trauma in the United States, 7 out of 10 adults have experienced at least one traumatic event in their lifetime, and some have experienced more. That's 70% of individuals in the United States. That equates to 223.4 million people. That's a lot of people. And when we think about the work that we do, 90% of persons seeking services through the public health system have experienced some form of trauma. And so pretty much we can assume that those we serve daily, live with, or work with have either experienced trauma or have been impacted by trauma. And when we think about that 70%, that means that if we're in a meeting with 5 people, at least 3.5 or more people have experienced trauma. And if you're in a meeting and there's 50 people, that means in a training or a meeting, that means at least 35 people in that room have experienced trauma. So again, trauma really does affect us even in our workplace and work environments. And so what's the impact of stress in the workplace? 83% of workers suffer from work-related stress, with 25% saying their job is the number one stressor in their lives. About 1 million Americans miss work each day because of stress. 76% of U.S. workers report that workplace stress affects their personal relationship. Depression-induced absenteeism costs United States businesses $51 billion in a year, as well as an additional $26 billion in treatment costs. And more than 50% of workers are not engaged at work as a result of stress, leading to a lack of productivity. So trauma-related and toxic stress-related symptoms are very important. So with these statistics, we need to understand the importance of creating trauma-informed environments. So, because we cannot underestimate the impact of stress in the workplace. And now Rebecca will talk about why we use the trust tool.
Thank you, Tia. So why use a tool like trust? What we're seeking to do in helping New Jersey become a trauma-informed and healing center state is to systemize the approach of what it means to be trauma-informed across the state. We know that there are people out there that already have lots of expertise and lots of experience in this field. However, we've heard from partners, from community members, from other organizations that there is not a clear definition of what it means to be trauma-informed and healing centered, nor is there a straightforward path to being recognized as such. And so that is the work of our office, the upstream efforts that we're doing to systemize the approach across the state. So when we say something, it means the same thing across different organizations. The trust allows organizations to assess the level of trauma-informed practices. We will be discussing what the trust is based on in the next few slides. But again, this idea that the first step for any organization is to figure out where they are in the process. And so this tool is wonderful both for that, as well as for providing resources to continue to move along a continuum of moving from being trauma aware to trauma sensitive to trauma responsive, and then ultimately to healing centered. The trust provides recommendations for bolstering trauma-informed practices. This tool is really useful because it is self-sufficient in a way. You take it, you get your results. It gives you the supports that you need to take the next step. And it gives autonomy to organizations to make improvements because of this, the way it's designed, in self-identified areas. Becoming trauma-informed is an ongoing process. It's never a one and done. And this tool is a way to measure those efforts. Next slide. And we, one of the organizations that we're beginning to work with, CASA, led by Tracy Heisler, has this quote here that I'll read for those who might be listening to this on their phone. Court-appointed special advocates of Somerset, Hunterdon, and Warren counties is using the trust tool to ensure that trauma-informed care gains that we have made in our program are fully implemented throughout our child advocacy mission. Trust will support our goal to do no harm to those families who have been impacted by traumatic experiences. Next slide. Go for it.
Okay. Thanks, Rebecca. Thanks, Tia. And hello, everybody. And I know that Rebecca introduced me in the beginning as a panelist. So I'm coming to you from CCSI, which is a New York-based organization. And my name's Jenna Velez. I'm the Director of Practice Transformation on the consulting team at CCSI. And this is really exciting to be part of this work with you all and seeing how I've been keeping tabs on New Jersey and all the great work that's being done through the Office of Resilience and otherwise. And it just feels like this is really exciting to see how a shared vision in the state is just strengthening and taking root in a new way. And I'm glad to be a part of that with you all, even though I'm not from New Jersey. So thanks for welcoming me and including me in this work. So what I'm going to share with you today is just information about the tool itself. And so I'll talk through some of the history, how it evolved over time, what you can expect if you complete the trust tool. I'll show you a sample of what a report might look like, and then we'll actually do a walkthrough of the website so you can get a sense of what it looks like. Some of you may have already decided to take a peek at the website. Some organizations I know have already registered and may have even deployed the tool. So this might not be new for all of you, but feel free. Also, there is a Q&A at the bottom, and we do want to leave time for questions at the end. But if a question comes up as I'm going through and you just want to put it into the Q&A, we'll make sure it doesn't get lost that way and have an opportunity to answer all those questions in the end. So as was stated before, the trust is the trauma responsive understanding self-assessment tool. And that can be a bit of a mouthful, so hence the acronym of trust. And this is a strengths-based organizational self-assessment tool. So it's really helping organizations to get that sort of, we call it a point-in-time snapshot of where they are in their journey towards becoming an equity-focused, trauma-informed organization. As Tia was talking about the values, I think the values are our anchor. That's the how we approach, the way that we approach everything that we do. But what we find is that sometimes it's hard to figure out how to operationalize that. What does it look like in practice? What are some of the things that we can do organizationally to support this work? And so the tool is designed to really help with that piece of things. There are other kinds of assessment tools too that kind of look at attitudes or culture and things like that. But this tool is really designed to give you a look at the operations and to help you figure out what does this look like in practice. So the trust, and when we say Trust 2.0, know that Trust 2.0 is because we had a recent update to the tool from the original Trust, and I'll talk about what is different. But I do want to just touch on a few of the key features here. I already referenced that this is a strengths-based assessment tool. So it will help when you get the aggregated report after your organization completes it. We do like to highlight areas of strength that exist, and so that you have something that you can build upon and recognize, well, where are we currently, and where are those areas of strength that maybe we can use to strengthen in other areas as well. So the tool itself is taken by individuals. It's completed by individuals, but it provides an overall snapshot of the organization. So it's really about aggregated scores versus it being about individual scores. And it's real, and it's used to evaluate the progress of organizations. It's not looking at the progress of individuals, but of those organizations. And so individual responses are not included in the report because we feel that anonymity is very important here. So we want to make sure that everybody has an opportunity to contribute and say, give their best sense of where things are right now without having to worry about, well, what will happen if I'm really honest here and it doesn't look good? Or, what will happen if someone knows how I scored? Will I get in trouble for that? Will there be any consequences? And so it does allow for that anonymity. For that reason, in a very small organization, we will only provide a report, or the tool will only provide a report if at least 5 individuals have taken the survey. And there may be certain places where, because we are looking at differences between leadership and staff as well. So when you're looking at those differences between staff and leadership, if there are fewer than 5 in any of those categories, then you won't see the difference. You would just see the aggregate of that. And again, that really is just about helping to ensure anonymity. And you can decide how often you want to re-administer the tool in order to assess progress over time. We do recommend that at least annually you utilize the tool, especially if there are specific goals that you're working on and you want to get a sense of, okay, how did this shift how we're performing in those areas or domains. So a bit about the history of the trust tool. So this was developed in partnership by the organization I'm representing, CCSI, and the Institute of Trauma and Trauma-Informed Care at the University of Buffalo, which is in New York as well. And it was funded initially by New York State Success. This was a SAMHSA grant, and the goal was to increase accessibility to all organizations across New York State to have access to a tool. So very similar to what the goals are of New Jersey and the Office of Resilience. It's about creating access, recognizing that, this is important. We need to know where we stand. We need to know how things are going and have tools to do that. But we don't want, you never want cost to be a barrier to that access. So it really was that funding that helped to support it. And, so the tool was designed to be able to be deployed to New York State organizations. And what we've seen over time is that it's been utilized by healthcare providers, networks of providers, state agencies in New York, county systems of care, county government programs, community-based organizations, mental health, and it was also adapted to actually be more relevant to education and school-based, those who are completing it as a school. So that's really what the Trust S was designed to do. So the Trust S was an adaptation to just have more school-friendly language. So in the Trust 2.0, as I referenced, that was updated just this year, actually. And what we did in the Trust 2.0 was, one, to make it responsive to the feedback that we were receiving from organizations about what would be really helpful and what could strengthen the tool. And so some of the things that happened within that update is that the tool itself is based on the 10 implementation domains that SAMHSA has for trauma-informed organizations. And I will walk through what those 10 domains are and what they mean. But what we did was go back and actually incorporate an equity-focused lens in each of those 10 domains. So the tool did not have that equity lens previously, which is now a part of all of the domains. So you'll see questions that are relevant to that in all 10 of the domains. And we also wanted to be responsive to the fact that some of those implementation domains are really specific to those who are providing direct services. And there wasn't really a way to differentiate that based on who is responding to the survey. So there were times where in organizations where maybe they don't provide direct services, or only a small subset provide direct services, they were kind of forced to answer all of the questions. Whereas now, based on how you provide your demographics in the beginning about percentage of time you're spending in direct service, there are certain questions that will just drop off. You don't have to answer those or try to figure out how to respond for your organization if you're not doing those things. So just provided a way for it to feel a bit more user-friendly for those who are in non-direct service providers and organizations. Okay, we can go to the next slide. Yeah, and I think this is probably just all information that you have already heard today, but let's just re-emphasize the fact that you as a New Jersey organization now have access to this tool at no cost. And so that this is being funded through the New Jersey Department of Children and Families. And we had this agreement over the next year to provide access to New Jersey. So very similar to how it works in New York right now, where all of our New York organizations have access to the tool for free. And I will share with you one story a bit later about how it's been utilized, but we'll say it's been really exciting to see how organizations are using the results of this assessment tool to continue on in their journey. We know that trauma-informed care is not something that's a destination. Rebecca said that too. It's not a one and done. This is ongoing work that will happen over time. It really doesn't end, because if it ends and it's not intentional anymore, and we're not working on progressing and really making that progress, then that's the point at which we, it's harder for us to say, yeah, we're a trauma-informed organization. And the nice thing about this tool is it's not just about here's your score, but it also provides a customized report on recommendations within each of those domains. So based on the strengths and based on the areas of need, there are some recommendations and resources provided so that you don't feel like, oh, okay, great, I'm seeing that maybe this is an area where there can be an improvement, but I'm not sure what to do about it. So you will have that customized report as well to help support your progress over time. So as we mentioned, the tool itself is based on the 10 implementation domains of a trauma-informed organization, and this comes from the definition of trauma-informed organization, the domains from SAMHSA. And so we have governance and leadership, and this really looks at how the leadership and governance of the organization supports and invests in implementing and sustaining a trauma-informed approach. So it looks at things like, is there an identified point of responsibility within your organization to lead and oversee this work? And are peer voices included in that governance and leadership? Then we have policy. So this domain is about looking at written policies and protocols being established with a trauma-informed approach as an essential part of the organizational mission, but also looking at just organizational procedures and cross-agency protocols and how they reflect trauma-informed values and principles as well. Physical environment of the organization. So that's just looking at how is the physical environment promoting a sense of safety for those who are accessing that organization, whether that be the staff or those who are coming in to receive a service, or those in the community. Engagement and involvement. So we know that people who are in recovery, who have experienced trauma, those who are receiving services, or communities, really all of us we need to have, all of us that I just mentioned, have a significant involvement, voice, meaningful choice at all levels and in all areas of organizational functioning. So that means looking at program design, implementation, service delivery, if that's relevant, cultural competence, access to trauma-informed peer support, workforce development, all of that. So it's really looking at how involved are those who are stakeholders or are in any way impacted by what that organization does. Cross-sector collaboration. So collaboration across sectors is we want to look at that being built on a shared understanding of trauma and principles of a trauma-informed approach. And while a trauma focus is not the stated mission of different service sectors, we do need to understand how trauma impacts those served and integrating that knowledge across service sectors is really critical. So we want to make sure that that's something that is being intentionally thought about. Then we have screening, assessment, and treatment services. And this is one of those areas that if you're not a direct service providing organization, you won't see these questions and they won't be a part of your report. or if only a subset of the organization is providing services, those scores will be limited to just those who are doing that work. So this is looking at how interventions, what they're based on. Are they based on the best available empirical evidence that we have in science? Are they culturally appropriate? Do they reflect principles of a trauma-informed approach? So we want to look at, is trauma screening and assessment an essential part of the work? Are the trauma-specific interventions, if those are offered, are they acceptable, effective, available, accessible to all individuals and families that are seeking those? And when trauma-specific services are not available within the organization, is there a trusted or effective referral system in place to facilitate those connections with appropriate trauma treatment? That's what that domain is looking at. Training and workforce development is looking at continuous training on trauma, peer support, how to respond to trauma, that's available to all staff. So a human resource system that incorporates trauma-informed principles in hiring, supervision, and staff evaluation, that there are procedures in place to support staff with trauma that have been impacted by trauma, or those that might be experiencing significant secondary traumatic stress from exposure to that material in their workplace. We're almost through all 10. I'm on number 8 now. So progress monitoring and quality assurance. So this is looking at whether there's an ongoing assessment, tracking, and monitoring of trauma-informed principles and effective use of evidence-based and trauma-specific screening assessments and treatment. We have financing. So we don't always think about the financing when thinking about a trauma-informed approach. It's not always the first thing that comes to mind, but we do know that financing structures are critically important. And so we want to know that they're designed to support a trauma-informed approach, which includes resources for staff training, development of appropriate facilities, establishing peer support, and evidence-supported trauma-specific screening assessment, service, and interventions where that's relevant. And then lastly, we have evaluation. So it's looking at that there are measures and evaluation designs in place that are used to evaluate service or program implementation and effectiveness, and that those reflect an understanding of trauma and appropriate trauma research instruments. So the tool itself is in 10 sections, and there's questions within each of these domains that are what lead to and contribute to the overall score that you will see. So I'm going to show you, if we go to the next slide, this is just a sample of what the report will look like when you get that aggregated summary. So there are also you'll also see within each of the domains that you also have each of the questions and what the score was there. So overall results are really given to paint the picture of where your organization is on your journey. And this includes areas of strength, and those are in green, emerging areas, which are in yellow, and then growth areas which are in orange. And the nice thing is that you can kind of get a sense of how this might differ in perception between staff and leadership. So is in this sample report here, you can see that the leadership is pretty consistently rating or scoring higher than the rest of staff. So that's an important thing to look at. And you'll also notice that this shows you the percentage of don't know responses in each domain. And that will also be available for each of the questions within these domains. So that's an important thing to look at too, and be able to look at, because it might tell you there's an area where either there isn't something in place and that needs to be addressed, or maybe there's some sort of communication gap where people are not sure how to answer that question. And okay, I think we already referenced that this is free, but I don't think that can be overemphasized, that this is available to you at no cost. And we want to make sure you had the link to the website, which we will do a walkthrough of in just a little bit, but this is the link that you can use to access the site and get directly to the New Jersey page. Or if you just go to the Trust website, which is at trust-survey.com, you can select New Jersey, and then what you see there will be specific to your state. Okay, so I'm going to pass it back over to Rebecca.
Thank you.
Thomas.
Dr. Lamort. Rebecca introduced me earlier. I'm the assistant director. Just wanted to talk through a couple of the things that are available to New Jersey organizations as part of being able to utilize the trust. We are also offering coaching sessions in collaboration. So if you're an organization, you've signed up, you've taken the assessment online, you receive your report, and you're interested in understanding what to do next, can certainly reach out to the Office of Resilience for support. So those coaching sessions are available to New Jersey organizations that are taking the trust. For the first year, we are being mentored into this process by CCSI so that beyond year one, which will take us through the end of June 2025, we'll be self-sustainable and we'll be able to continue offering those coaching sessions. So right now we're in a piloting phase. And we are taking on a more limited number of organizations to coach. But with that being said, if you're interested, please reach out so that we can coordinate with organizations that are interested in that coaching. And the coaching would range from just about at least 1 hour to let folks know what is in their report, how to get oriented to the report, how you might want to utilize that report, and just become familiar with some of the domains, the questions within those domains, and how you might look at differences between leadership and staff. So that would be a minimum of 1 hour. And then we are offering the up to quarterly sessions over the course of 1 year. As Jenna mentioned earlier, you'd be encouraged to take the trust again after 1 year to see what progress your organization has made. In the interim, we hope to offer, and we will be offering next year, what we're calling learning collaboratives. So those will be opportunities to really become familiar with each of those 10 domains that Jenna talked about, and will sort of serve as a co-learning opportunities for organizations to be able to jump on. And let's say you're really interested in learning more about governance and leadership, or engagement, or financing, you'd be able to jump on these learning collaboratives and really understand not just what the domain is looking at, but some ideas and suggestions, and really collaborative work in partnership with other organizations that are maybe struggling with the same things or doing those things well and want to share some knowledge and resources. So as I said earlier, if you're interested in that, please do contact the Office of Resilience. We do have our email listed here. It's tcf.officeofresilience, all one word, at tcf.nj.gov. So that is our main point of contact for the coaching sessions. We're also offering at the Office of Resilience a foundational training. It's called Foundations of Trauma, Resilience, and Healing-Centered Cultures. And so this training is an 8-hour foundational training that is really intended to shift folks from the trauma-aware continuum. So if you're starting off as just trauma-aware, want to move toward trauma-sensitive, this would be a great place to start. And we are offering this training at no cost to those organizations that are interested. It is an 8-hour training that is offered in 2 4-hour sessions. And typically, we just suggest that folks take that about 2 weeks apart to allow those participating time to process the information. And so this is really what is covered in this foundational training. Talk about the types of trauma. We're talking about the neuroscience, positive childhood experiences will be covered, the toxic stress, and then translating that science into practice. We'll be talking about regulation and co-regulation, vicarious trauma, Sansa's model of trauma-informed approaches. We're talking about healing-centered strategies and ways to build resilient communities. So right now we are working with organizations to schedule out these trainings for 2025. And so there are a number of host organizations that are able to pull together other organizations. The Office of Resilience is small but mighty. So we just really want to be able to maximize our reach. And so that is the reason that we are asking to be able to pull a number of organizations together so that we can promote this training and really extend our reach as far and wide across the state as we can. So if there are any questions on this or interest in this, you can again contact us at the same email, dcf.officeofresilience@dcf.nj.gov. And so I'm going to hand it back to Jenna, that is going to talk a little bit about one particular organization's journey and then walk us through the tool itself.
Yeah, thank you, Fidelmas. And I know there was a question in the Q&A about how to access the trainings, which I think Tia has answered there. So if you want to go to the Q&A as well, I think she provided the same information there that Adamas did about the email address, but just so no one's left like, oh no, I didn't get the address. I think the email address was also put into the chat as well. So lots of places where you can access that. So I don't know if you've ever had this experience, but there, for a long time, trauma-informed has been a bit of a buzzword. And, everyone's trauma-informed and every website says they're trauma-informed and everyone says they're trauma-informed. And then if you ask the question, well, how do you know? That's where it gets a little bit more difficult. And you can get a whole range of responses there. Like, I know I did a training and I understand this. And I think it's easy to feel overwhelmed almost because trauma-informed practices and trauma-responsive practices, they impact every single thing that we do. I mean, we just talked about those implementation domains. It's broad and it really looks at everything, including your financing. So it's very hard, I think, for us to just intuitively say, oh yeah, sure, I know where we are. And I know that I can consistently know that staff across my organization would also say the same things. So I like this quote from one of our New York partners who has utilized the tool. And I'm going to read it again, just for anybody who might be listening and that can't see what's on the screen, but it says culture transformation is hard to measure outside of typical metrics like program outcomes, staff retention, and satisfaction. And we were thrilled when CCSI developed the trust survey because it was a resource that we could use free of charge and benefit from consulting services and community partners to help us drive strategy for the future. And that is the key right there. Help us drive strategy for the future. So this isn't about just like knowing and feeling like, oh, good, I can feel really good about where we are right now. It's also not intended to leave any organization feeling like, oh no, my scores weren't that great. And now I feel a little bit hopeless. I thought we were doing a good job. And now I'm seeing that there's a lot of area for improvement. This is intended to be a hopeful and helpful tool that can help you drive that strategy so that your journey is guided by actual information and data versus having to just sort of think, well, I don't know, how would I answer that question? Am I really trauma informed? Is my organization really trauma informed? And how can we stay on this path over time? How can we stay on this path forever, recognizing that there will always be evolving opportunities to strengthen these practices? So with that being said, I am going to, I think, now take over control of the screen so that I can walk you through the website so you can see what it looks like. All right. Bear with me for just a second. Here we are. Okay. So I'm going to start where if you follow the New Jersey specific link, where it will take you. It takes you immediately to the resource section. And this is a good place to start if you're new to the website. Let me just check in quickly. Are you seeing this, the website? Okay, perfect. So in the resources section, you'll see informational webinar recordings are coming soon because guess what? This webinar is going to be available as a recording. So you can come back and look at it again if you need to, or you can share it with anybody who you think would benefit from seeing that. So we will have this webinar recording there. But also I want to just call your attention to this getting started and technical guidance. So there are some additional resources, New Jersey specific, that will be added here, but there are a lot of resources already here that you can access and benefit from. So even just the logistical pieces of how do I register for an account? So, you can always just go to login/register and follow the instructions. But if you want to have a sense of, what that looks like and what to expect, these are just quick little videos that help walk you through the process and what that looks like. There's also a video here for how to set up a program. So some organizations that are larger and want to have a sense of not only their organizational score, but program specific scores can actually set up multiple programs when they're registering their organization. And so this video would walk you through how to do that. There's also a video about how do I actually send out the survey. So what will happen is once you register and, decide, okay, we've decided on the dates that we're going to do this, you will get an individualized link and a sample message that you can use to share out with your staff, which is a really helpful tool. So like, you don't have to create anything yourself, that your staff at your organization are not going to have to create any kind of login. There's really just a login for your organization administrator, and then everybody else just follows the link and completes the survey. And then there's also a video to show you once your survey is done, your survey round is done, how to run that survey report and what that would look like. So then there's also some helpful guidance just on interpreting. How do you understand your Trust S survey report? How do you understand your Trust 2.0 survey report? And so some of what will also be added soon is just implementation support guidance as well. So to give you some helpful tools and resources, and again, just being updated to make them New Jersey specific. And those will be on the website shortly when we get the website upload or the webinar uploaded as well. And then you can also find the information here. So as Idalma's talked about, the consultation that's going to be available if you're curious about that, want to learn more, that there's the email address to learn more. And then also for more information, the Office of Resilience website is there as well. Okay. Then, so that's the resources section. There's also an about section here as well. So that's just some of the information that I covered before too about the trust itself and how it was developed, the history, specific information for New Jersey, an overview of those domains I talked about, because I'm sure you didn't retain all of that information as I was talking through all of that. So you can go back and look at it there, and then information about CCSI as well. So we also have an FAQ section, the frequently asked questions. So who can take the survey? Is there a limit to the number of people? Lots of questions that we tend to get. And I covered a lot of these today already. So about the 5 or less, we have to have at least 5 for there to be anonymity. But the good news is that if you have a large organization and you're worried that there are too many, there really isn't, there's no limit. So even though you have to have 5, there isn't a top limit there. The survey is anonymous, meaning that we won't be able to see, you won't be able to see any individual scores. It's really just the aggregated data. The survey, I don't know if I said this, but takes about 10 to 15 minutes to complete. We do recommend that before you send out this survey to your staff, that maybe you want to make sure that the staff have some basic understanding of what does it even mean to be trauma informed. So whether that means starting from a place of, reaching out to the Office of Resilience about the foundational training, or offering some other kind of foundational training, just so that there's some foundational language and understanding, so that as somebody's completing that survey, they know what's being asked of them. Otherwise, you might end up with a lot of don't know responses, and you could use that information too. And maybe what you're looking at for progress is seeing that don't know response coming down. So let's see, I see there's some things in the chat. Oh, okay, that's it. And yes, so again, these are FAQs that are the questions that we've heard most often in New York as organizations started to use the tool. So I'm not necessarily going to go through all of them now because they're there memorialized on the website. And then there's also a contact section. So this is to get in touch with somebody on the trust team, which is my organization, CCSI. And, so if you're having any sort of technical difficulties or you have a question about the tool itself, that would come to us. Now, if you have a question that's more related to the training or to consultation or something like that, we would recommend you still send that to the Office of Resilience, but we're here to help assist with any kind of technical questions or issues that are coming up. So that's essentially what you will find on the website. So this is intended to really be a self-service type of tool. You can go in at any time, set up your account, send out a survey round, access your report without ever having to interact with anybody on our trust team at all. And we're here to support you if there are any issues that come up, but it really is intended to be user-friendly and to give you the resources that you need to be successful in deploying the survey. All right, so I am going to stop there. And I think, Edonis, this is where we're going to have some question and answer. Great.
So I want to thank everyone for their time. I wanted to take the opportunity to just see if we have any questions that we have in the Q&A section. I'm going to check. We had the one which Tia addressed, which was just our website. Not our website, our email address that you can contact for the foundations training, as well as coaching or any other questions that you may have for us at the Office of Resilience. So that is our main point of contact and email. And you can also access our website if you go through the Jersey Department of Children and Families. The Office of Resilience does have an internet page that we try to keep as up to date as possible. So the link for the trust is there, as is information about the trauma-informed approaches, continuum of those definitions that Tia talked about earlier, and other resources that you might find useful.
Okay, so there is a question in the Q&A. This is a really good question about trust. Clarifying, is Trust 2.0 used internally in Trust S for students? So actually, these are all staff. So they're actually not filled out by students or clients or communities. This is really staff driven. So the Trust S is for schools. And so who would be completing that would be your school staff, versus the Trust 2.0 is for organizations that are not educational institutions. That was a good question. Thank you for asking that.
While we're waiting for more questions, I think it's always interesting to think about who in a school or who in an organization would it be everyone?
Yes. Ideally, it would be everyone. Yeah. Because the nice thing about that is it helps you understand if there are areas where maybe more information is needed by certain groups, or especially if you're looking at differences between programs too, it can help you understand that. But yes, for sure, all staff, because trauma-informed practices are apply to everybody.
I think one of the things we're increasingly realizing as we work with organizations is all the information we're talking about when we're teaching about trauma-informed and healing-centered care applies to ourselves as much as it applies to the people we serve.
Exactly.
That's the reason why everyone, like in a school, including the bus drivers and the people in the cafeteria and everyone, they are employees too. They're a part of the community. I tend to think now of communities as the staff as the community of the organization.
Yeah.
They serve. So,
right. And when we think about the statistics of how many people, I mean, it's the vast majority of us have experienced some sort of trauma or adversity in our lifetime. And if we haven't, if we're part of that small majority that hasn't, we are interacting every day with people who have. So it benefits all of us, and it benefits our communities at large when we have that understanding and can recognize the way in which, like, how we go about doing things in our organizations and our practices, our policies, our communication, that it all matters.
it's a universal approach.
Yep.
And I've included the update, the introduction to the foundations of trauma, resilience, and healing center cultures training for your information. So it is included in the chat.
And I can actually share, if it would be helpful, I can share also a sample report of what you see within the individual domains, if that would be helpful too, just to give you another look at that. So let me just get that. Oops. Okay, so you should be seeing what I shared before in the slide was this, which is the overall results. And this is just a sample. This is not our real organization's report. So there's a sample here of, okay, so in the main section, you're going to get the overall aggregated totals for each of the domains. So the total mean score overall for staff and then for leadership, as well as the percentage of don't knows. And then, and this is just a couple of, this isn't all of the questions that are included, it's just a sample. But if we look at governance and leadership, for example, here's 2 of the questions that are included in that section. And so you can get a sense of what those questions are. Members of my organization's governing bodies reflect the diverse identities of the communities that are served. And then they're rating it along a continuum from not at all to very much, or don't know. And so you can see the percentages that led to the overall score for that domain by like each of the individual questions you can see. The second question is, there's a formal equity-focused trauma-informed initiative in place aligned with my organization's strategic plan. And then below that are the recommendations. So there's sort of a summary of what was found there, and then some additional support materials that can help in implementing and putting some emphasis. The idea here is not that you take this and do absolutely everything, because you can't take it all on at once, but that there's a process to give you some resources to say, all right, this is where we want to start. This is what we're going to do now. Let's see if we can make some progress there. And then we'll go back and maybe work on a different domain or think about where we want to go next based on priorities. But that's just an idea of what the report itself looks like. So you get the overall for that specific domain, and then you'll see, this is only a few, but you'll see all of the items and questions and their ratings. I don't see anything else in the Q&A.
Other questions? We are recording this, so we will be able to have it available for those that were unable to attend. I do understand a couple of people, tried to log on time if weren't able to make it. So we are recording it and make arrangements to have that set.
Maybe also important to share is that results from data analyses conducted on pilot data in the Trust S and the Trust 1.0 and 2.0 all demonstrated construct validity with a single construct of trauma-informed practices and strong internal consistency of the total score and all 10 domains. So sometimes people ask, like, is this a validated tool? So it's good to know that the measure has been validated.
All right, with that, then I think we can draw to a close here. I want to thank our panelists for your sharing your expertise today, and thank you, most importantly, to the community for attending. We look forward to being supportive of your efforts to become trauma-informed and healing-centered. So I wish you all a very good day.